All right, hello and welcome to the Florida Medicare 101 webinar. It is now 11 o'clock right on the dot. For most of you, this is your first Medicare workshop. My goal today is to help you get a better understanding of Medicare and the options that are going to be available to you. My name is Chaz Mulheron. I'll be your Medicare guide today. I hope the audio is good for you, so I'm going to put a little question up right there. This webinar should last about 1 hour. If you have any questions, you can ask them in the chat function in the top. You're going to see a lot of numbers and that I'm going to throw out there for Medicare cost and deductibles and everything today. But I can send you these by email as well. At the end of this presentation, you'll have the opportunity to fill out a survey. If I have your email address, I can send you a Medicare 101 booklet, and all of these costs and Medicare cost and IRMA and everything you're going to see here. So that way you can spend more time watching and not have to take so many notes. So with that, we will go ahead and begin. It looks like everybody's audio is good. All right, first you should know this event is for educational purposes only. No plan specific benefits or details will be shared. What I mean by that is you guys are getting tons of stuff in the mail every day, I'm sure, from Humana, United Healthcare, Florida Blue, Health First, Cigna, and so on. I can't sit here and go through every single plan details. That would just take forever. This is educational. I'm not connected with the federal Medicare program. I'll tell you the same thing I told my mom. My mom started Medicare last May. My dad has been on Medicare for 5 years now. But I told them that Medicare will not call you on the phone. Medicare will not come to your door. They're going to give you a Medicare and U book and say good luck. So any of those phone calls that said where the Medicare helpline, that's not Medicare. Those are typically going to be private insurance companies. All right, who are we? Well, our company is Florida Retirement Group. That's who I work under. Our office is located in Maitland, which is North Orlando area. I live in the Orlando area here, but we do live classes. I do seminars. I have one tonight at a library here locally. And I also do online webinars for people that are not in the Orlando area. My company, though, that I actually own is Mulheron Insurance Services. So if you get any emails from me, you're going to see Mulheron Insurance Services, but I work under Florida Retirement Group. All right, your host, that's me, Chaz Mulheron, your insurance advisor. But if you go on to the Department of Insurance in Florida, and if you type in my license number there, you're going to see that actually Charles Mulheron shows up. I've gone by Chaz my whole life since I was born from my mom, but I'm really Charles Stephen Mulheron III. That's what shows up. And I've been in this business since February 11th of 2009. So I just hit 14 years in the business. And I love it. I plan on doing this as long as Medicare is around. If Medicare is not around, I'll find something similar to this. I'm not going anywhere. Course overview. Well, what are we going to talk about today? We're definitely going to talk about the 4 parts of Medicare. That's your Part A hospital, your Part B medical. What about those Medicare Advantage plans? I'm sure you guys are are seeing lots of TV commercials on every day. Joe Namath, Jimmy Walker, William Shatner, probably somebody else out there doing it now. And they're talking about these plans, getting extra benefits. They're just referring to Medicare Advantage plans. I'll talk about that. I'll also talk about the fourth and final part of Medicare, which is Part D, your drug coverage. And then we'll talk about Medicare supplement plans, also known as Medigap plans. And then your enrollment. When should you enroll in Medicare? Do you have to enroll in Medicare? And if you don't, are there any penalties? What if you're still working? What do you do then? I'll make sure I go over all of that with you this morning. All right, did you know that Medicare started back in 1965? We're now 57 and a half years since Medicare started. And you can see the first recipient there is President Truman. And that's what your Medicare card used to look like on the right-hand side over here. It had your Social Security number on the top. And they no longer do that. Now, yesterday I had a seminar at the library, and I think there was about 13, 14 people there, and a few people already had their Medicare card. Most of you probably won't have it, so I want to let you know what that Medicare card is going to look like today. When you get your Medicare card, obviously it won't be this big, but it's going to be a red, white, and blue paper card. It's going to have your first, middle initial if you have one, and last name. And then it's going to have a random generated Medicare number or Medicare ID for you, no longer your social security number. So that's good. All right, let's go back to my main slides. Medicare versus Medicaid. I want you guys to know the difference between this, because when I was new to Medicare back in 2009, if you would have asked me the difference, I would assume they were the same thing. So I like to let people know what the difference is. You guys are here today most likely because of Medicare. You're probably turning 65 soon, which enables you to get Medicare. So Medicare is eligible for people that are 65 and older, but people that are under 65 could get Medicare if they have a certain disability or end-stage renal disease. Medicaid is different. Medicaid is different from every state, and it's run by the state. And they can pay your Medicare cost. But in order to get Medicaid, you have to have limited income and limited assets. If you're curious on what those numbers are, I can talk to you one-on-one, and we can see if you qualify. But these numbers change every 6 months, so they're always moving. If somebody has Medicare and Medicaid, they're considered dual eligible. You have both. Let me get up my little pin right here. There we go. All right, let's go to the next page. The basics of Medicare. That's what we want to know. We want to know what that Part A and Part B of Medicare is. So, like I said, back in 1965, they had that Medicare card, your Part A and Part B. It's still the same today. The only difference is the cost. So let's say your Medicare starts this October. You can take your Medicare card, your Part A and Part B, and you don't have to do anything else. You don't have to get one of those Advantage plans or those supplement plans. You can just take Medicare A and B and be done, because that's your original Medicare. But I want to let you know what that Part A and Part B will do for you if you just have that, okay? And again, you don't have to write these numbers down. I'll have all these numbers that I can email to you if I have your email address. First, you should know Part A. These numbers are for 2023, by the way. Part A is going to start most likely on the first day of your birth month. So we'll use myself as an example. My birth date is January 27th. If I were to start Medicare next January, my Part A would start on January 1st. This is always true. It'll always start on the first day of your birth month, unless you're born on the 1st. I don't know if anybody here is born on the 1st, but if you're born on the 1st of the month, you'll get it 1 month earlier. Okay. Part A, if you are taking notes, but again, I'll have a paper that will show this. Part A is free. There's no monthly premium for Part A. Right there, no premiums. That's assuming you paid into Medicare. You know, when we get our paychecks every week or every 2 weeks, there's a Medicare tax that comes out. As long as you've paid into Medicare for 40 quarters or 10 years, then Part A is free. You can even be somebody who is 1099, and you know, like me, I don't get a paycheck really per se, but I still pay Medicare taxes. So as long as you've paid into Medicare for 10 years, Part A is free. People who did not pay into Medicare, they could have a monthly premium. Now, if you say, well, Chaz, I didn't pay into Medicare for 10 years, what do I do? My next question would be, have you ever been married to somebody who paid into Medicare for 10 years? If that's true, you can collect Medicare from them for free. If not, your premium could be as high as, I think the new number is like $508 a month for Part A. That's very rare, so that shouldn't happen to you. All right. So we know Part A costs $0 per month, right? It's not going to cost you anything to be on it, but Part A does have costs associated with it. What do I mean by that is that if you actually use your Part A, there's going to be costs because you're using it. So let's use an example. Let's say somebody here, their birth date is September 20th. And they say, okay, Chaz, my birthday's September 20th, so I start Medicare Part A September 1st, right? September 1st, knock on wood, I hope it doesn't happen, but they call me and they say, Chaz, I'm in the hospital. What is this going to cost me? My first question to them is, are you admitted as an inpatient? And if they say, yes, I'm actually in here, I'm going to be here for several days, then yes, that will fall under Part A. If they were to tell me, nope, I'm just in the emergency room, I'm going to be leaving here in an hour, okay, that's going to fall under Part B. We'll talk about that next. But Part A, you must be admitted. If you're admitted, Medicare will cover a semi-private room, meals, general nursing, hospital services and supplies, and they'll cover all but the first 3 pints of blood. Now, when I say they cover that, it doesn't mean they cover it in full. They'll approve it, but you're going to have some costs associated with that. And those costs I'll refer to as gaps in Medicare. A gap in Medicare is what Medicare won't cover. They're going to pay all but. So the first gap in Medicare is days 1 through 60 right here. Let's say you call me up and you say, Chaz, I was just in the hospital for 3 days. What does that cost me? I'll say, well, your first benefit period is day 1 through 60. You have a 60-day window that you could be hospitalized, and your deductible is $1,600. The Part A of Medicare will cover the remainder amount. I've seen a hospital bill that was, $60,000, and it was like 3 days in there. Under Part A, they will cover the whole hospital stay, whatever you get done in there, and your deductible will be $1,600. Now you say to me, well, Chaz, I went in for a few days. I came home, and 2 weeks later, I got hospitalized again. What's that going to cost me? Well, guess what? You're still in that 60-day benefit period. So that actually won't cost you anything. Now, if you call me up and 3 months later, you're hospitalized again, well, that 60-day window has closed. So you start back on day 1 and you will pay $1,600 again, or whatever it is for that year. Now, let's say you stay longer, days 61 through 90. Not very common, but it can happen. Your copay is $400 every day that you're in there. I just had a guy recently, October 5th through December 28th. He was hospitalized. That was just this past year. The wife called me at the end of December. So every day, days 61 through 90, you would pay $400 a day. Every day, days 91 through 150, you would pay $800 every single day you're in there. And these are your lifetime reserve days, meaning you can, once you use those days up, they're gone forever. Anything beyond 150 days in the hospital, Medicare does not pay anything. They also will not pay for the first 3 pints of blood or comfort and convenience items. Now you say, well, Chaz, what happens when I get out of the hospital? A lot of times it's true where they might not send you home. That guy that was actually just hospitalized back in October through December, they sent him to skilled nursing care. That's why the wife was calling me. She's saying, Chaz, what is this going to cost him for this skilled nursing care? Well, as long as you've spent 3 days in the hospital, Medicare will cover the first 20 days in skilled nursing care. That's inpatient rehab. After day 20, though, you will pay $200 per day. That is your gap in Medicare. You will owe that. Medicare covers acute care. Get in, get better, and go back home. You have to show progress that you are getting better. Otherwise, you got to go back to the hospital or home. But Medicare will cover those first 20 days. Anything beyond 100 days in skilled nursing care, Medicare does not cover that at all. Medicare will not cover long-term care. You're responsible for that yourself. Either Medicaid could pick it up, or if you have a long-term care insurance policy, or just cash. Okay, so that's Part A. Remember, everything inpatient. If you get hospitalized, you're most likely going to have a $1,600 deductible. I hope I mentioned this before, but if you guys do have any questions, you can use the chat function. Let me know if you have any questions about a particular side. Okay, we're going to move on to Part B. I'm going to put a little poll question up here. Do you know how much the Part B premium is this year in 2023? go ahead and answer that if you wish to. We'll get started on Part B. So we know Part A is everything inpatient, right? Part B is the opposite. Part B is everything outpatient. So you got your primary doctors, your specialists, emergency room, urgent care, MRIs, CT scan, lab work, ambulance, outpatient surgery, chemotherapy. Anything outpatient is going to fall under Part B. Now, Part B is optional. The government cannot force you to take Part B. By the way, remember, I have all these numbers and stuff I can send to you by email. And Part B is optional. The government cannot force you to take it because it does have a monthly premium. Unfortunately, it's not free. Part B this year, if you want to write it down, is $164.90 every month. That's actually down from last year. Last year, it was $170.10. So there is a monthly premium for Part B. And oh, by the way, if you don't take Part B when you're first eligible, and in the future you decide to pick up Part B, there could be a 10% penalty for every 12 months that you were eligible for Part B, but you did not take it. So in the future, if you decide to pick up Part B, that penalty will last forever. There are limited exceptions. This is where you probably want to write it down, but at the same time, make sure you talk to me one-on-one and I can find out what we need to do. So if you are still working, or maybe your spouse is still working, and you have coverage from that employer, you may be eligible to delay Part B. There has to be some stipulations here. That one is there has to be 20 or more employees at that employer. 2, it has to be creditable coverage. Now, people love to tell me, oh, Chaz, I have Blue Cross Blue Shield. I know it's credible. They're a big company. That does not make it credible. It's the deductibles, the co-insurance, the coverage that you have from your employer has to be considered qualifying or at least as good as what Medicare offers. Only your human resource department or your benefits department can determine that. They have to let you know. Sometimes, every now and then, I'll have an employer that just, they don't know the answer. And I don't know why they don't. They're supposed to know that answer. It's definitely listed on the benefits package. But if you have creditable coverage from an employer, you can delay Medicare until you're ready to retire. What if you have a marketplace plan? You say, Chaz, I have Florida Blue or Cigna, and I'm paying $50 a month for my marketplace plan that I purchased on my own. It's not from an employer. Can I delay Medicare? You may not. You cannot delay Medicare. There will be a penalty, and you're no longer eligible for a subsidy through the marketplace if you're eligible for Medicare. When can you sign up for Medicare? Well, you can sign up 3 months prior to your month of eligibility, but it won't start until your month of eligibility. What I mean by that is my birthday again is January 27th. If I were to start Medicare this January, I can enroll in Medicare October, November, and December. It won't start till January 1st, though. I can also enroll in January. I can enroll in February, March, and April. If May hits, every 12 months from my birth month, a penalty will start to accrue if I take Medicare later on, assuming I don't have creditable coverage. Now, remember, Part B is everything outpatient. The first gap in Medicare is this $226 deductible that is owed by you. So let's use an example. Let's say August 1st, you start Medicare, and on August 1st, you go to the emergency room. And let's say that bill is $2,000. Well, the first $226 is going to be out of your pocket. Then the remainder amount, which is about $1,774, you're going to owe 20%. Medicare will pay 80% of it. You're going to pay 20% of that $1,700 is about, $350 or so. Not a big deal. Hey, it's not bad. But what happens if the next day you get an emergency room again and it's $5,000? Well, you've already met your deductible. It's a calendar year deductible, January 1st through March 31st, which is good. So you've met your deductible for the year. But now you got to pay 20%. If it's a $5,000 emergency room visit, you're going to pay $1,000. Well, what if it's an outpatient procedure and you get MRIs and stuff done, and all of a sudden You've racked up a $15,000 bill. Well, now you're going to pay $3,000. You will always pay 20%. There is no cap to that 20%. What do I mean by that? We all probably have some sort of insurance right now. Maybe you don't have any insurance, but if you've ever had insurance, your insurance plan had a cap, had a maximum amount of your responsibility. I'll use myself as an example. I have a $2,500 deductible with my insurance. Then I pay 20%, just like this, up to $5,000. Now, it's an infinite amount of coverage, but my maximum responsibility is $5,000. Under Medicare, there is no maximum responsibility. You can spend $5, $10, $15, $20,000. Hope that made sense. And the last thing here is excess charges. Very, very uncommon. But your doctor might say, I accept Medicare. You go to your doctor's office, you give them your Medicare card, they take it as payment. They'll say, hey, you owe 20%. Oh, but by the way, we want to charge an excess fee on top of what Medicare approved. We're allowed to do that. Medicare says we can. I can charge an excess fee of 15% above what Medicare has approved. This is very, very uncommon. I used to see it a little bit more. Mayo Clinic up in Jacksonville used to do it, but they no longer do it. If you're concerned about your doctor and if they charge that excess fee, you can call them. They'll tell you. You just say, hey, do you take the Medicare approved amount, or do you charge Medicare excess fees? Or you can go to medicare.gov, find a provider, type in your doctor's name, and it'll say if they charge the Medicare approved amount. I don't want to bet you, but I bet your doctor does charge the Medicare approved amount. It's very, very uncommon. Okay, next page, Part B. Again, we're still talking about Part B. We know that premium is $164.90. Non-hold harmless provision. This just means that Medicare cannot raise your Medicare premium higher than your Social Security increase. So right now, if you're collecting Social Security, or in the future, if you're collecting Social Security and you have Medicare, and all of a sudden next year, the Medicare says we're going to raise this premium by X dollars, your Social Security increase has to be at least that high. So if I've seen it in the past, I think a decade ago, we used to see a couple of years where no increase in Social Security. If that happens, if they don't increase your Social Security, they can't increase your Medicare premium. That's just a hold harmless provision that they have. Now, if you're collecting Social Security, your premium is automatically deducted from your Social Security check every month. That's pretty easy. If you're not collecting Social Security and you do plan on going on to Medicare, you might want to write this down. If you're not collecting Social Security and you go on to Medicare, you're going to be billed quarterly. I'm kind of surprised. I make sure I mention that to people a lot because I do get a lot of calls from people saying, hey, what is this Medicare bill that I got of $497 from Medicare? That's your quarterly bill for Part B if you're not taking Medicare. So $164.90 times 3 is $490 something. I don't know exactly, but that's the quarterly bill. Now, Medicare will let you pay monthly if you want to set up automatic monthly withdrawals. If you're collecting Social Security, though, you don't have to do that. People that have Medicaid from the state, remember that help from the state because of their income, the state will pay your Medicare premium up there. Otherwise, most people are going to spend $164.90 a month for Medicare. Now, I say most people because not everybody. If you're a high income earner, you're actually going to pay more for Medicare. Now, you definitely don't have to write this down. If you want to screenshot it, you can, but no reason to write this stuff down. Again, I have a page I can send you that will have all of these numbers listed on there. This is called IRMA. You can even Google IRMAA, not IRMA, but there's two A's there. And that stands for Income Related Monthly Adjustment Amount. What this says is if you're a high income earner, we're going to charge you more for Medicare. The government wants more money. And oh, by the way, we're going to look 2 years back on your tax return. So because we're in the year 2023, they're going to look at everybody's income from 2021, not just you guys, but people that have been on Medicare for 5, 10, 15, 20 years. They always look 2 years back. They're going to look at your taxes and they're going to look at your modified adjusted gross income from 2 years ago. If you are single and file individual and you made $97,000 or less, you're okay. You're going to pay $164.90. If you're married and filing jointly and you made $194,000 or less, you're okay. But you can see the more you make, the more Medicare costs. Now, you guys are probably thinking a couple of things here. So I know what most of you are thinking. So I'm going to try to answer that right now. One is, well, Chaz, in 2023 or maybe 2024, 2025, you're going to retire. This happens to me often. I have a guy right now I'm working with. He plans on retiring this June when he turns 65. And he said, Chaz, they're going to look at my 2021 taxes. I'm married and we made $275,000 right here. He's worried that his Medicare premium is going to be $329 a month. And he said, well, that's not fair. I'm retiring this year. Well, I have a form we can fill out. It's a life event change form, SSA 44 form. We fill it out and tell the government, yes, in 2021, I did make a lot of money, but now I'm retiring and I don't feel I should have to pay that. Or if he's done his 2022 taxes and it was less then he can file that as well. But obviously in 2022, he made a lot of money as well. Now I always tell people, be careful, be careful what you make. And people say, well, I can't help what I make. You make what you make. If you're making a lot of money, that's good. But there's other ways to be careful. 2 years ago, I had a lady I talked to. When I talk to you one-on-one, one of the first things I do is I pull up this slide and I say, hey, did you make less than that? And for her, I did my normal thing. And I said, hey, did you make less than $97,000? And she said, yep, I'm a school teacher. I made less. Okay, no problem. I almost made a mistake there because 2 weeks later, we talked again. She was ready to sign up for Medicare and that whole process. And she said, oh, by the way, in February, I'm going to retire as a teacher. And just to let you know, I have a 401k, $250,000, and I plan on cashing that out. I'm going to live a little. I'm going to pay off my credit cards, pay off my house, or fix up my house, whatever she was going to do. And it's going to be nice. What do you think of that? And I said, well, obviously it's your money. You can do what you want to do, but here's a couple of problems with that. A 401k, you have never paid taxes on it before. So if she took all that money out, when she did her taxes the following year, she is now going to be somebody who didn't make $50,000, but $50,000 plus her $250,000 in her 401k. So now her income taxes will be a lot higher, a higher tax bracket. But not only that, because I'm not a tax advisor, but I am a Medicare person that can help you out here. That would have put her right in here. She would have been $300,000. She would have 2 years in the future called me and said, Chaz, why am I paying $527 a month for Medicare? And I said, did you win the lottery? Like, what happened? And she would have said, well, I took out my 401k, and that would have been, unfortunately, for the whole year, you have to pay that Medicare premium. So be careful. We ended up moving her money. Thankfully, I moved it over into an IRA. She's taken a yearly income to keep her income less than that $97,000 while she's still gaining interest, but safely. She's now 66. She doesn't want that money to go down at all. So we have it in safer money for her. So just be careful there, if you do take any money out and retire. All right, guys, remember these numbers I do have in a sheet that I can send you. The third part of Medicare is Part C, Medicare Advantage plans. I'm sure you guys are seeing tons of commercials every day from all those people I said, Joe Namath and Jimmy Walker and William Shatner. What they say during these commercials are, get the benefits you deserve. Get dental, vision, hearing, money back in your Social Security check, 0 doctor copays, all while costing $0 per month. Well, there's kind of some truth there. They are Medicare Advantage plans, but there's some things you have to worry about with those. They're not perfect. They're not 100% perfect. We'll talk about the pros and cons of Advantage plans, but what you should know is it's a private insurance company. It's Florida Blue, United Healthcare, Humana, Cigna, all those different companies out there will offer an insurance plan. And the only way you can get this is if you have Medicare A and B, you're eligible to get it. A Part C plan, they'll give you things, yes, like dental, vision, hearing. They'll even give you drug coverage thrown in, so you don't have to go out and buy a drug plan. But they're nothing new. The commercials are new. I haven't started hearing those till about 4 or 5 years ago. I have clients that call me every week. Someone will call me and say, hey, what are these advantage plans, these free plans I'm hearing about on TV? And I'll mention these are nothing new. These came out in 2006. And oh, by the way, half of my clients have these. And I'll say, you already have one of those. And they say, what? I didn't realize that. So there's nothing new with these plans. They've been around for a while. Like I said, we'll talk about the pros and cons here in a little bit. The fourth and final part of Medicare is your Part D drug coverage. Drug coverage is optional as well. Maybe you don't take any medications. Maybe you never will take medications. Maybe you're more holistic. Well, the government can't force you to take a drug plan. But if you do not take a drug plan when you're first eligible, and in the future you decide to pick up drug coverage, you could have a penalty, a lifetime penalty. And that penalty is 1% of the national average drug plan premium for every month that you did not have it. So let's say you went a year without drug coverage. You have a 1% penalty. The national average drug plan premium is about $35. So the 1%, it's about 35 cents. And you say, oh, but I went 12 months. Okay, 35 cents times 12, it's about $4 and change. So if you were to pick up a drug plan a year after you were first eligible, you would have a $4 and change penalty every single month for the rest of your life. There are limited exceptions, just like with Part B. One, are you working? Is your spouse working? Do they have 20 or more employees? And do you have creditable drug coverage? So you got to ask them, is my medical creditable? And is my drug coverage creditable? If it is, then you can delay Part D. Or maybe you have VA benefits or TRICARE or CHAMP VA. That is all creditable coverage. What if you have a marketplace plan, the ACA plan? Those are not creditable. You have to go on to Medicare. I do have a quick question here from Vicky. And let's see, I'm in collecting widow's benefits. My husband passed. Yes, so if you have like any kind of benefit, whether it be a Social Security, but yeah, widow's benefit, then yes, you will have your Medicare premiums automatically deducted from that check. You'll get a Medicare card automatically. I'll talk to you about that. But you'll get the premiums will come out automatically as well. And Social Security will send you a letter confirming that. Now, when can you enroll in a drug plan? You can enroll in a drug plan during a 7-month window. That's 3 months prior a month of eligibility. It cannot start to your month of eligibility, though. You can enroll in a drug plan the month of eligibility and up to 3 months after. If the 4th month after your birth month, if you don't have drug coverage, your penalty starts to accrue back from day 1 of your month of eligibility. So be careful there. And you can change drug plans once a year. Last summer, I hit over 1,000 clients. And every year, October 15th to December 7th, that is my busy time. I send out 3 emails to my clients, one at the end of September, one in the middle of October, and one in the middle of November. I urge them, I say, look, just click this link right here. I send them a link. They can schedule a quick phone call with me. I get an update of their medications. And I say, okay, here's what your plan's doing. Here's what I recommend. It might be to recommend to stay put, or it might be to recommend to move. Whatever plan changes you make become effective January 1st. Be careful. This year, there could be a deductible of up to $505, meaning some drug plans won't cover anything until you meet that deductible. So make sure you know your plan. Use an agent. Even if it's not me, I'd rather you use me. But if it's not me, make sure you use an agent. There's no reason not to. We can never charge you anything. You can never pay us anything. We're just the middle person to help you find something. Whatever plans you choose, that company pays us for helping find you. There's no downsides for you to use us. The only downside, I guess, would be is if you use somebody that was captive, meaning that they only have one plan. For instance, yesterday at my seminar, I had a guy at the end of it say, oh, I went to Walmart and somebody there worked for Humana and they talked to me about a plan. And that's fine. Humana is a fine plan. I'm not going to say it's bad or anything, but that Humana person can only talk to you about Humana coverage. So guess what? They're going to be biased on how great Humana is. Humana can be fine, but it's not made for everybody. My parents even have different plans. Everybody's different. There's only two ways to get drug coverage through the Medicare system. So what I mean by that is there's no government drug plan. And people say, well, what's the government drug plan? Well, that's Part D of Medicare. It's overseen by the government, but it's actually from private insurance companies. To get drug coverage through the Medicare system, you can either buy a standalone drug plan, meaning that it only covers drugs, just drugs alone, and you pay for that plan, or you can get a drug plan that is integrated into one of those plans you see on TV, the Medicare Advantage plans, MAPD, Medicare Advantage with prescription drugs. And again, if you make too much money, Medicare, Social Security says they want that money from you because you make too much. You don't have to write this down. I will have this in a sheet as well. This number here is obviously outdated. This is the national average drug plan premium. I believe it's $35 this year. I forgot to update that. And again, they use your modified adjusted gross income. And you can see if you make $97,000 or less, you're not going to have any penalty. So you're going to pay. If your drug plan is free, you're going to pay $0. If your drug plan is $20, you're going to pay $20. But if you make more, they're going to add a penalty or a tax to your drug plan premium, even if it's $0. All right. So we talked about the 4 parts of Medicare, your Part A, Part B, Part C, and Part D. There are no more parts of Medicare. Next, we're going to talk about Medicare supplement plans, also known as Medigap plans. There's that word gap, Medigap. So remember when we talked about the Part A costs? Remember the $1,600 deductible, the $400 a day hospitalization, the $800 a day. And then for Part B, we talked about the $226 deductible plus the 20%. Those are the gaps in Medicare. If you choose a Medigap plan, you are telling a private insurance company, United Healthcare, Florida Blue, Cigna, that I want to purchase you and I want you to come in and cover the gaps of Medicare, those gaps we talked about. So always know if you hear that word Medigap, it's also known as Medicare supplement, it covers the gaps left over from Medicare. These are private insurance companies and they have strict federal guidelines, meaning that the Medicare, the government came in and standardized these plans back in the mid-90s. They standardized them all. They're all identical. So how do you know which one to choose? Now, this next slide here, you don't have to write this down. If you want to screenshot it, you can. If you happen to be on a computer that can do that, or a tablet or something. If not, like I said, I'll send you a Medicare 101 booklet. It will have this chart in here because it's a lot of stuff going on there. Okay, so let's start at the left-hand side. Left-hand side right over here. These are the benefits. And remember, these are the benefits from insurance companies. So what this is saying is Medicare Part A coinsurance and hospital coverage. The coinsurance for Part A was days 61 through 90, days 91 through 150. And then after 150, Medicare doesn't pay anything, but the benefit of this plan will pay an additional $365 or 365 days after the Medicare benefits are used. And you can see, you see a checkbox all across the top. But then you look at it and you see plan A, B, D, G, K, L, M, N, C, F. And it gets very confusing because these are letters that we just saw from Part A and Part B and C and D. Well, these are insurance plans. These have nothing to do with Part A, Part B, other than just covering what's left over from that. So in their infinite wisdom, the government said, hey, we're going to letter these plans A, B, C, D, E, F, all the way to N. They shouldn't have done that. They should have numbered them or anything, put a symbol. So make sure you know what you're hearing. Are you hearing Part A or are you hearing an insurance plan A? Plans cover the parts of Medicare. Probably the best way I can put it there. Okay, so on the left-hand side, benefits, we see the Part B coinsurance, we see blood, hospice, all the way down. You see all that stuff that we went over from Part A and Part B. Some of these plans will cover it and some of them will not. So let's go over to the far right, Plan F. Plan F, if you have a neighbor, neighbor says, oh, you got to get the coverage I have. It's 100% coverage. When I get hospitalized or if I go to the doctor, I never have a copay for anything. Well, yeah, they're telling the truth. That's Plan F. Plan F has every box checked, meaning on the left-hand side where the benefits are, everything that I went over for Part A and Part B, it covers 100%. It will cover 100% of that, but no more, meaning if Medicare doesn't cover it, the Plan F cannot cover it. So Medicare doesn't cover dental. Well, guess what? Plan F is not allowed to cover it. They're standardized by the government. Only problem with Plan C and Plan F is that you must be eligible for Medicare prior to January 1st, 2020 in order to get Plan C or F. So most likely, most of you here are not eligible for Plan C or F. No big deal. The new Cadillac plan is Plan G. It's not really a new plan, but now it is the Cadillac coverage. We talked about Part A hospital. It will cover 100% everything on Part A. So when I send you that sheet that has the Part A cost, if you choose Plan G, it covers everything 100%. For Part B, it covers your co-insurance, which is at 20%. It covers blood for Part A. It covers Part A hospice, skilled nursing care, Part A deductible. Oh, but here's one thing it will not cover. Get that box right. It will not cover the Part B deductible. Go back and think. Was it the $164.90? Nope, that's the Part B premium. In order to be on Medicare Part B, you got to pay $164.90. That you got to pay. But the Part B deductible is $226 in 2023. So Plan G will cover everything from Part A and Part B except that $226 deductible. Does it cover drugs? Nope, because that's Part D. If you get a supplement plan, you have to get a separate drug plan. There are other plans available here, but for time purposes and for simplicity, we're just going to talk about Plan G here, okay? I got a question from Lucy. Retired federal employee. I already know where this is going. So I still have my work health insurance. I'm turning 65 this year, but I do collect Social Security, or I do collect Social Security yet. So I'm not sure if you're saying you do collect Social Security. I think you're trying to say you don't collect Social Security yet. Do I need to sign up for Part A? Well, you're saying Plan A. Remember, Part A is a hospitalization. Plan A is an insurance plan, or is it automatic? In 2022, in 2021 and 2022, I sold real estate. Yeah, unfortunately, if you're a retired federal retiree employee, FEHB, they're going to recommend that you take Medicare A and B. They will recommend that, but you don't have to. So make sure you do talk to me. I'll explain this, but when you get when's your birthday? Just this year. 2 or 3 months prior, the federal employee retiree benefits, they should send you a package saying what happens to people that are on Medicare. And that usually they'll tell you, you're not required to take Medicare Part B, but if you don't, and you later get Part B, you're going to be penalized. If you do take A and B, it does make your coverage better. It just costs you more. So that's really going to be what you prefer. If you can, yeah, in 2022, you made more money too. So yeah, talk to me separately about that one-on-one, and I can try to help you out there. All right, page 20, your Medicare options. So eventually you're going to go onto Medicare. And let's imagine you don't have a federal retiree employee or TRICARE or something else. But let's say eventually you go onto Medicare and you do need to make a selection because you don't have any other options. Well, if you get your Medicare Part A and Part B, you do have 2 options. Option 1 is to choose a Medicare supplement plan, that Medigap plan like Plan G, and then decide if you want to add drug coverage. If you do that, then you're done. I mean, unless you want to add, dental or vision or anything. Or you say, I have my Medicare A and B. I want to add a Medicare Advantage plan. You can do that as well. That includes your drug coverage already, so you're already done. And a lot of them will include dental and vision as well. Now, you probably don't know which way to go yet. I don't expect you to. My mom, I had the same conversation last January, a year ago with her. And at this point, she wasn't really sure which way to go. So for these next couple of slides, I'm going to try to give you a better idea of what might be a better option for you. By the way, Lucy, you will not do either of these. You're either going to take Medicare with your federal retiree coverage, or you're just going to take your federal retiree coverage. So you don't need to worry about this. Same thing if you have TRICARE. I don't know if anybody here has TRICARE for life. If you have TRICARE, you don't have to do option 1 or option 2, or don't need to. So let's compare the benefits. We're going to compare the benefits of Medicare supplement versus Medicare Advantage. Then we're going to compare the cost, because that's what really gets people kind of decided one way or the other. So Medicare supplement plan, if you choose that, Medicare is your primary, and the Medigap plan, plan G here, is secondary. Medicare pays first, whatever's left over, the supplement plan picks up almost all of it, except for that deductible. If you choose that, because Medicare is your primary, you can go to any doctor, any hospital nationwide that takes Medicare. Meaning, if you find out the best brain specialist is in Chicago, your only question to that doctor is, do you take Medicare? If the answer is yes, you have both coverage. You don't have to worry about what your insurance company is. People always ask me if they have a supplement plan. Oh, I have United Healthcare supplement. Can I see this doctor? Well, actually, your United Healthcare doesn't matter, because you have a supplement plan. It's, do they take Medicare? No copays. Once you meet your $226 deductible, doctor visits are free, MRIs are free, CT scans, chemotherapy, inpatient, outpatient surgery, whatever you get done medically or hospitalization-wise, you're going to be covered at 100% after your little deductible there. This is the more comprehensive coverage, but there's going to be a premium to this. That's why people would choose this. There's no other out-of-pocket cost you have to worry about when you use the plan. Don't forget, it's not allowed to include drug coverage. So anybody who has a supplement plan, they typically get a standalone drug plan. People that choose these want more freedom. They want the more comprehensive coverage. They say, Chaz, I'm willing to pay to get the best coverage, because I know right now I'm healthy, but in the future, maybe something will happen. I want to have that good coverage. Or maybe right now I do have health concerns and I should have the better coverage. You get that freedom of choice of doctors, no referrals, no copays. And the biggest thing that a lot of people don't take into consideration is no prior authorizations. I haven't personally dealt with it myself, a prior authorization, but I've had clients that have. A prior authorization is where you want to get an MRI, let's say. Well, right now, Florida Blue is my primary insurance. If I wanted to get a procedure done, I have to get approval, prior authorizations from my insurance company. Under Medicare, Medicare is not an insurance company. It's your primary insurance. There is no prior authorization process. It's either covered for everybody or covered for nobody. So there's no prior authorizations that you have to worry about. So that's more Cadillac coverage, but you don't get the extra stuff like the dental, vision, and hearing. The other option, option number 2, is a Medicare Advantage plan. These are made up of HMOs and PPOs. This is what we've all been used to for the last, if you're 60, turning 65, for the last 65 years, you're more used to the Medicare Advantage plan style of insurance. What do I mean by that? Well, you're going to have a network, whether that be an HMO network or a PPO network. HMOs typically mean you need to stay in network. If your doctor doesn't take the plan, you don't have access to that doctor. If you have a PPO, you get a little bit more freedom. You can go in or out of network. If you go out of network, you're typically going to pay more. PPOs, you don't need referrals generally to see a specialist. HMOs, you typically do need a referral. So, a little opposite there. But all of them are going to have copays. Just like right now, I know I have a PPO. If I see a primary doctor, it costs me $50. If I see a specialist, it costs me $75. These plans are tailored the same way, except the copays are much lower than I have. Most plans, the copays are $0 for a primary doctor. Specialists can be anywhere from $10 to $35, just depends on your plan. But there are going to be copays. Expect to have copays. If you get hospitalized, there's not going to be a deductible. Like right now, I have a $2,500 deductible. I know if I get hospitalized today, the first $2,500 is out of my pocket. Then I'm going to pay 20% up to $5,000. Medicare Advantage plans are a little better than that. There's no deductible. You get coverage from day one, but you're going to have a copay that you will owe per day that you're in there. Every plan, make sure you know what is the out of pocket. What's the maximum out of pocket on my plan? It's the most that you can spend in a given year. Drug coverage is included. Dental, vision, hearing, they give you all the little extra stuff, but it's not as comprehensive as a supplement plan. And oh, by the way, you might need a prior authorization for certain procedures, just like you probably do right now. A lot of times you might not notice it. People that choose these don't mind copays. And in exchange, it costs them less per month to be on Medicare than the supplement plan. Maybe their doctors are already taking the plan. Maybe they like that their drug coverage is covered under there, the dental and vision. So there's two different ways to go there. So now that's the way the benefits work different. But now we're going to talk about how the cost difference, because this is where it gets a lot of people to kind of switch, between one and the other, or really which way they want to go. Let's say you choose Medicare as your primary, which means you have Part A and Part B, right? Well, we know Part A is free. We know Part B is most likely $164.90. But if you want to add a Medigap plan like Plan G, in addition to that, you have to pay roughly $169, maybe even more for a supplement plan. Why do I say more? Well, it depends on where you live. Different zip codes have different premiums. It depends if you're male or female. Males cost more than females. And it depends if you're a smoker or non-smoker. But remember, every Plan G is exactly the same. There's a Plan G that's $169. There's a Plan G out there for the same female non-smoker in the same area. That's probably $230. Why would anybody buy the $230 one? There's no reason to. I'm an independent broker, so I do work with all the companies. I don't always do the cheapest one, but you want to have a company that's a big name that is not going to be gone anytime soon. And you got to look out for their rate history, because these companies can have rate changes. And I know these companies forward and back. And the last thing you might want to add is a drug plan. Those start at $8.40. So you could easily spend $340, $350, $360 a month if you're looking for the Cadillac coverage, the better coverage. They're not going to give you all the shiny extra stuff like the dental, the vision, and the hearing, but they do give you comprehensive coverage when you really need it, and you go wherever you want to go. On the flip side, the Advantage plans over here are going to be kind of the opposite. Well, yeah, you got to have Medicare A and B, right? So you're going to pay the $164.90 unless you make more money. But Joe Namath was not lying on TV. The Medicare Advantage plans actually have a 0 monthly plan premium in addition to Medicare. Every time I talk to somebody, and I'll ask you the same thing, do you think you were looking more at supplement plan or Advantage plan, or are you keeping an employer plan? I'll ask you that question. But people say, well, yeah, some will say, I want to do that Advantage plan, but really, what does it cost me? Well, it'll cost you $164.90 for Medicare, and the Advantage plan does not cost anything on top of that. They get reimbursed from Medicare each and every month. And oh, by the way, some plans will reduce the Part B premium here. The way they word that on commercials on TV is get money back in your Social Security check. What they are doing is lowering your Medicare premium. So that way, if you don't take Social Security, they can't give you more money in your check. You're not getting anything. Well, they're really lowering how much you owe Medicare each and every month. Those plans are not made for everybody. The plans that reduce Medicare's premium typically means you're going to be losing something else. These Advantage plans get paid the same from the government, roughly the same. So if they're giving you money back in your Social Security check, they're probably going to have a smaller network of doctors, or maybe they're going to have higher copays. So you can you got money back in your check, you got low copays, and you got a lot of doctors. You can pick two of the three. That's pretty much how it goes. Drug coverage is included. You don't have to worry about paying for a drug plan. But don't forget, you're going to have copays for your specialists, for your hospitalizations, maybe for your medications. So this is the Advantage plan, is the lower cost per year, unless you have a lot of health concerns, and that might end up costing you more. So you got to be careful. I work with everybody individually to kind of tailor a plan for you, because I'd say 50% of my clients choose a supplement, 50% choose an Advantage. The ones that don't choose anything are typically clients that I work with, maybe like Lucy, that I'll talk to and work with and tell her, hey, you know what, you're going to do your federal retiree with Medicare without. And I don't mind, don't think you're wasting my time or anything. I like talking to everybody. Maybe in the future, you know, she'll know somebody who needs help with Medicare and send them my way. So again, you never pay me anything and I can show you what's available. A common question I get with this right here, this page is, Chaz, especially my male clients, they'll say, Chaz, I will just take a Medicare Advantage plan. I'm healthy. And then in the future, if I get unhealthy, I'll just move on over to that Medicare supplement plan. Can I do that? Sure, you can. You can move to a supplement plan, but when you're new to Medicare, there are no health questions. The supplement plans are not allowed to decline you. They can't rate you up. They have to cover everything from day one. But after the first 6 months that you have been on Medicare, if you're not on a supplement plan, they do not have to approve you in the future. I'll repeat that again. I know it's a little much to take in. Supplement plans, no health questions when you're new to Medicare, whether that be 65 or starting Part B. But after 6 months, if you're not on it and you want it later on, they can decline you. They're going to ask health questions. Cindy, you have a question. Go ahead and if you want to type it in, you should be able to type in the chat function there. All right, let's go next page here. We're on the last home stretch. Okay. Election periods. When can you sign up for Medicare? Well, right now you guys are in your initial enrollment period, coming up soon, probably runs all year. That runs 3 months before your month of eligibility. Remember, you're 3 months before your birth month, a month of, and 3 months after. Once you've been on Medicare, you can change plans during the annual election period, which runs October 15th to December 7th. I make sure all my clients know these dates where we can, you know, make sure we don't miss the dates or anything. During that time, you can change your drug plan or your Medicare Advantage plan. Special enrollment period. Maybe you call me in the middle of the year because you just moved. Well, we can change plans in the middle of the year. Open enrollment period. That's January 1st through March 31st. This is when you get another opportunity to change your Medicare Advantage plan, but you cannot change your drug plan. All right, I got a question from Cindy. I will be getting TRICARE for life in July. Do I still need to pick up an Advantage plan? No, you don't need to. You can if you want to, but Cindy, with your TRICARE for life, it will act like a supplement plan. So either Medicare is going to be your primary, where you can go to any doctor that takes Medicare, and TRICARE can be secondary. You want to make sure they take both of them there. Or you can choose an Advantage plan to be your primary, but then you have to stick to that network and they have to take TRICARE as well. So typically with my clients that have TRICARE for life, I tell them just to do Medicare as your primary and TRICARE secondary, and your drug coverage is in your TRICARE. But yeah, you do have to have A and B of Medicare, but you don't have to have an Advantage plan if you don't want to. All right, when should you enroll in Medicare? Well, ask yourself if you're still working. Maybe your spouse is still working and you have coverage from that group insurance. Maybe it's good coverage. Maybe it's cheap. Well, if it is, you can stay with your employee group insurance and you can delay enrollment into Part B with no penalties, no loss of options. Make sure you reach out to me. I will show you how to do this to make sure you don't have any penalties. Or maybe you're still working, you have coverage, but the coverage is not good. Every now and then I'll talk to somebody, they're saying, hey, I'm paying $1,000 a month or $700 a month. Well, you might be better off to leave your employee group insurance. They have to let you off when you're eligible for Medicare, and you can choose a Medigap or a Medicare Advantage plan. Diane has a question. What if you are a disabled veteran and your doctors are at the VA? Which plan is best? There's no plan that is best. That would actually be illegal for me to even say what's best because everybody has a different situation. That said, Diane, I do have pretty good options for people that have VA. Typically, and I don't want to say this is right for you, I'd have to talk to you to know exactly, but typically my clients that have VA and like to use the VA doctor, they typically choose a Medicare Advantage plan with one of those Part B givebacks, meaning they lower your Medicare premium. And again, I'd have to talk to you one-on-one to see if that's the right option for you. But typically that works. You know, I can definitely show you what companies will do that. Depending on where you live, there are plans that will reduce the full Medicare premium, meaning you don't pay Medicare anything. So make sure you talk to me about that. All right. Are you collecting Social Security benefits right now? And what I mean by that is it could be Social Security benefits from your own or maybe a spouse or a previous spouse. if you're collecting some kind of retirement benefits, your enrollment into Medicare is automatic. Even disability income, your enrollment into Medicare is automatic. You'll get your Medicare card, and I can let you know when you'll get that card when I talk to you on the phone. If you have employer insurance, you might want to delay Part B. I can show you how to do that. Or maybe you have your Medicare A and B card come in, and maybe you're like Lucy and you have a retiree plan. That's the retired federal employee. Well, you take your Medicare with that. Or maybe you don't have a retiree plan. You can choose a Medigap or a Medicare Advantage plan. If you're not collecting Social Security benefits, that's most people now, not most people, a lot of people, not more people now than it used to be. Your enrollment into Medicare is not automatic. We have to do that manually. I can show you how to enroll in Medicare. No reason to do it on your own. I can never charge you anything. But let's say you're not collecting Social Security and you need to delay Medicare because you're still working and you have coverage from work. Well, you want to delay Part B. It'll automatically enroll you into Part A. You might as well have Part A. It's free. That's always true unless you have an HSA, a health savings account from work. Otherwise, take Part A. It's free. Maybe you're not collecting Social Security benefits, but you want to enroll in Medicare. I can show you how to do that, and you can choose a plan if you want to. Okay, how to enroll? Well, you can call Social Security, wait on hold. Finally, when they answer, you say, "Oh, I want to apply for Medicare." Yes, you have to call, or you have to do it through Social Security, not Medicare. You call Social Security, you wait on hold, and they'll say, "Oh, okay, we'll schedule an appointment to call you back in a month." Yesterday, I had a lady. She said, "I wanted to do it that way, and they never called me." So she had to call and wait on hold again. So that's not an ideal way to do it. You can go to the Social Security office. If you go there, they're going to make you schedule an appointment, most likely. I recommend doing it online. So yeah, Diane, you are collecting Social Security benefits. So I can tell you when you'll get your Medicare card and what option might be good for you. But if you're not collecting Social Security, enroll online. You need to have a My Social Security account. You enroll into Medicare from Social Security. I can show you how to do that. Schedule a phone call with me. Very, very easy. You'll have my cell phone number at the end of this. Also, I'm going to put up a little slide in the middle of the screen here in a minute, and it's going to where you can click and you schedule a time on my calendar. You pick the time whenever you want. It's a phone call. It's usually a quick phone call or a Zoom if you'd rather Zoom. Some people want to be face to face, like we're right in front of each other, but totally up to you how you want to do it. But today, what I recommend, if you have time, go to ssa.gov, create that account. Even if you're collecting Social Security, like Diane, you might be collecting Social Security, you can create an account at ssa.gov still. It does not sign you up for Medicare or Social Security automatically, but you can go in there and look how much you've made over the years, and you can order a new Social Security card, this and that. And of course, I made this slide in October, and then in November, they updated their website. So it looks a little bit different than this, but yeah, in the top right-hand corner, click sign in, sign up. Then you're going to click right over here, click on create an account. Then on step number 4, you're going to click create an account again. That will say, what's your email address? You know, they're going to send you an email. Then you have to confirm your identity by entering in your driver's license. I think my mom did hers a couple years ago. So I went through it with her. I had mine, but I've had mine for 10 years now. I've had it for a long time. Okay, so supplement plans. There are 30 carriers with the exact same 10 plans. That's the Medigap plans. How do you know which one to choose? Use an agent like me that's an independent broker that is not going to be biased. This is the nationwide coverage that you can get, the more comprehensive coverage, but it does cost money. Maybe you need a drug plan. There's 23 different drug plans here in Florida. How do you know which one to choose? I can help you narrow that down to probably one that will work for you, specifically for you. Now, Medicare Advantage plans are different. You might be a Diane where I already have a couple of companies in mind that I think I might want to show her. Or you might be somebody who doesn't have VA and when you use the VA, well, there might be different plans that are available for you, but everybody's different. So don't assume just because your neighbor has a plan that it'll be right for you. And I might have mentioned before, my parents are both on Medicare Advantage plans, and they have 2 different companies, not even on the same one. I tried to get them to do the supplement plan, but they just did not want to do it. So can't help them. Medicare partners, I'm an independent broker. Bright Health has pulled out of Florida, but then I picked up a company called Ultimate Healthcare. So, I pick up companies anytime they come in the area. There are a select few that I work with more often. But if somebody wants a different plan that I don't write as much, I don't mind writing it. Remember, I'm an independent broker. What happens next? I have a Medicare 101 booklet. To request that at the end of this webinar, when you exit it, you're going to get a screen that'll pop up, a blue screen, and it's going to say, we'd like to hear your feedback. It's just a review about me. One of the boxes I think you can check will be that you want the Medicare 101 booklet. If you put yes there, I will send it to you in an email. I will also attach a Medicare facts page with all the Medicare costs for Part A, Part B, the IRMA, everything, if you want that. So that's the survey that will pop up right there. It'll say, thank you for attending. We'd love to hear what you thought about the presentation. You hit the start button. It's like 2 minutes. You're going to get a thank you email automatically from the system that I use. This is called Big Marker. This automatically sends out an email, I believe. My assistant, she reaches out one time. You might have spoken to her or heard a message from Sue. I don't want her to bug you. She reaches out one time, and then you get an email from me if you do not schedule a time to talk. If you don't want to talk at all, just let me know. That's fine. I'll take you off the list there. I have my cell phone number there, but right now you're going to get a slide out that'll come on your screen. It pops up at the bottom left right there. You click that link. It says schedule now. It'll open up my calendar. You can click on it. I'll click on mine right now. It'll open up a separate calendar.